Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your host, Brad White, and today we are joined by Dr. Mustafa Baldawi with Aultman Deuble Heart and Vascular Hospital. Good morning, doctor, and welcome to the show.
Good morning, Brad, and thank you very much for giving me this opportunity. And thanks for everyone listening and or watching. Um,
Wonderful. Thanks, doctor, for joining us. We'd like to remind our listeners that today's program is also available on our podcast. It can be downloaded from the App Store on your mobile phone. Just look
How's
for
that?
Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. You can log on to medshopperx.com and you can check out our podcast past episodes also. Aultman Deuble Heart and Vascular Hospital is the largest group of board-certified cardiologists in Stark County. Their commitment is to deliver scientifically based diagnostic and treatment options.
How am I now?
We got you.
Am I live? Okay.
Yep.
All right. Okay. Good morning, Dr. Baldwin. Please tell us about your background and your specialty.
I was born and raised in Iraq, and I went to medical school back at the University of Baghdad. I moved to the United States for training and specializing and subspecializing. I did general surgery training in Toledo, Ohio. I did a critical care training in Henry Ford Hospital in Detroit.
Mm.
And eventually, my passion for cardiothoracic surgery, I did that part of training in Loma Linda, California. I worked for a year and a half in Texas, and make it full circle, I came back to Ohio.
Gosh, you've been all around. I really like that hospital. Henry Ford is really beautiful and it's huge, isn't it? As I recall.
Great, yeah, yeah, it's huge.
It's been some time since I've been up there, but anyway, go ahead, Brad.
All right, doctor. Can you talk about what is cardiothoracic surgery?
So cardiothoracic surgery, or uh, a lot of specialties call it thoracic surgery, is the subspecialty of is a surgical specialty that deals with the diseases in the thorax, and the thorax is the area that contains the lungs, contains the heart and the major vessels and the aorta specifically. Also deals with the diseases of the diaphragm, the disease of the esophagus, and the chest wall in general, whether reconstruction and injuries.
Okay. So let's talk about minimally invasive techniques.
Minimal invasive techniques, obviously, like in any other surgical specialty, it has been increasing more and more over the last maybe 10, even 20 years. Um, in As far as my training and as far as the thoracic surgeons in general, uh, most of the minimally invasive techniques are being used for the esophagus and for the lung surgeries, whether it's lung resection or diaphragm surgeries. As far as the heart, the due to the complexity of heart surgeries and the difficulty in adopting these techniques, which involves a lot, uh, because in heart surgery you have to involve a heart lung machine, you have to think about a lot of logistics. The adoption to those, it's been increasing, but not as widely adopted as lung surgeries and esophageal surgery.
So, Dr. Baldawi, are there other conditions that cause someone to need cardiothoracic surgery?
So we'll start with since we're in the heart month, we start with the heart. The most common procedure we do is the coronary bypass grafting, which means disease in the coronary arteries, which are the blood vessels that supply the muscle of the heart. Now, this is the most common all across the country, or probably all across the world. The second is valve surgeries, whether it's the aortic valve or the mitral valve. Other surgeries in the heart is the surgery in the aorta. Now, as we as we are advancing more in the field of cardiac surgery per se, there's more and more of transplant and mechanical support devices. So this is for the heart. As far as the lungs, the two main categories would be the lung cancer surgery, whether it involves a small resection or a biopsy or a bigger resection of the lung. And the other category will be the infectious processes, whether it's a what we call empyema, which is an abscess around the lung or inside the lung. Esophageal surgery also involves the cancer category, which is cancer resection for esophageal cancer, and also surgeries for the hiatal hernias or reflux disease, and what we call foregut surgery, which is the initial or the beginning of the gastrointestinal tract. Diaphragmatic surgery and is less common. Chest wall surgeries are also, but it's mostly for either reconstruction after injury or for congenital deformities.
So, are these surgeries all common with an open chest, or do we use robotics or laparoscopy type of process, or?
The definitely they all can be done in the open technique. So what we call the approach to surgery, whether it's open or laparoscopic or robotic, or the laparoscopic robotic, we call them minimally invasive, just because the skin incision is smaller. And definitely when it comes to heart surgery, the incision on there will be smaller incision, whether it's on the sternum or on the chest wall. The minimally invasive surgery to the lungs, as I mentioned before, it's been mostly nowadays being done with the robotic consoles. As far as heart surgery, there's a combination of using the robot or a combination of using the minimally invasive techniques with the smaller incisions. So long story short, the open techniques has been the standard. It's been done for decades, and it's the standard to which all other approaches are compared to when it comes to outcomes.
So, do you work closely with the cardiology team before, during, or after surgery to follow the patient's progress? What does this partnership entail?
Absolutely. The cardiac surgery is a team sport, and definitely working with cardiology team throughout all the phases of the surgical treatment, whether before surgery, as far as diagnosing the condition and the referral from them. And the second part of this partnership before surgery is what we call optimizing the patient before we get them into surgery. A lot of patients who, especially when it comes to the heart failure or valvular abnormalities or valvular diseases, they will require some what we call medical optimization to make them best suited and optimized for surgery. Immediately after surgery, the cardiology team and our cardiology colleagues are first of all, they were notified about the surgery and how everything went, and they will be seeing the patients right away after they leave the hospital from us. On the long term, for sure, the cardiology team is the team who follows the patients for diagnostic purposes, for adjustment of their medications, and for referral for other further problems if needed.
Okay.
All right. What can people who have already had pretty good health status do to keep their hearts healthy?
So all these recommendations that we're gonna be talking about, whether it's for exercise or health, I emphasize to all patients there is no one solution. The two big things that I always tell all my patients is the consistency, is the combination of these things, and the balance and moderation. So the first thing that comes into our mind is a healthy diet, and we'll talk about that more.
Yes.
So that's very important. The second, and as we all know, is the physical activity. Maintaining some sort of physical activity, and we'll talk about that as well, or a combination of physical activities to for each patient is also important. The other important factors is maintaining a healthy weight, uh, smoking cessation. This is very important. Smoking is a very big risk factor for cardiovascular diseases in general and heart disease. Moderate alcohol consumption, and there's other areas that we call primary prevention, whether it involves maintaining the normal cholesterol level, maintaining good blood pressure, sleep hygiene is very important, and managing stress. A lot of these preventative measures are managed with our first line of physicians or healthcare professionals, which are the primary care physicians, and these are the I would a lot of time call them the unknown soldiers that are spread all over and help prevent the diseases from happening or from worsening if they start to happen.
It's time for our first break, Doctor. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your flu, pneumonia, COVID, or shingles vaccine online at medshoprx.com. So did we handle the exercises or not?
A little bit. I was going to follow up, if you don't mind, doctor. Before, you covered the whole gamut that we all hear a lot, health, movement, moderation. There seems to be a lot of push lately to just get people to walk. I mean, and it seems like that can be an effective exercise. Do you have any comments on that?
Walking actually is a very effective exercise, and obviously walking is slow versus brisk walking. We'll prefer the brisk walking, but again, it's very good for cardiovascular health in general, whether it's the heart, the lungs, the blood vessels. It has enough. I mean, brisk walking can get you to spend a lot of calories, just like other form of exercises. So a lot of, especially younger people, can tend to underestimate the effectiveness of walking. It helps with muscle strength, especially lower extremity. Mental health is also a big part when you go for a nice walk in wherever you like to walk. Joint health is very easy on the joints compared to other form of high impact exercises. It helps to maintain our balance, our coordination, and it's very convenient. You don't have to have a lot of gadgets to have a nice half an hour or 1 hour walk, whether by yourself with your friends, and due to all of the above, it has a lower risk of injury compared to other forms of exercise.
Mhm.
So, long story short, walking is a very, very effective form of exercise.
Anything else how about heavy physical, exercise and, weightlifting of light weights and all that kind of stuff? Is that a possible way to keep your heart in condition?
Absolutely. The main categories of exercises, which is the aerobic exercises like walking, running, swimming, the muscle strength exercises, whether with gym equipments or resistant bands. There is the other forms of exercises, which is the high intensity interval training, and we have what we call the flexibility exercises. I think there is no one category that's better than the other when it comes to heart health. I think the best is consistency and combination of all of those. And again, I cannot recommend for someone to do weight training every day if they're if they cannot do it, whether it's for logistics standpoint, whether it's for their joint standpoint. So again, everyone has to tailor these forms of exercises to what suits them. But again, the most important thing is the consistency to help us stay healthy.
So, doctor, what is the best diet or meal plan to follow for a healthy heart? You know, I really like coffee, okay?
All healthcare professionals do. So there's a lot of studies, and I'm not gonna claim that I'm a nutritional specialist, but again, I think the best diet would be number one, balanced diet. Number two, trying to stay away from the processed food. The more you stay away from that, generally it's healthier. And we talk about fruits and vegetables, healthy fats, the unsaturated fats, heart healthy nuts, peanuts or cashews or these are all good for health. But again, I I would not recommend eating nuts with so much calories in them because that will be harmful at the end. So again, balancing all those is also important. When it comes to heart, from the heart standpoint, definitely limiting water, limiting sorry, salt, limiting added sugars, and drinking good amount of water. These are also very important. So I'm not gonna give you a secret recipe for diet. Forgive me.
What, no salt?
You can have some moderation.
Well, I was always told that the beef coming right from cattle has plenty of salt, and the same with pork and that sort of thing, plenty of salt. You do never need to put any more salt on it.
Yeah, and then one thing I would like to add is all these forms of diets or exercises, their effect would not show in one meal or two meals. Their effect, whether it's a bad effect or a good effect, it it requires time, which is where consistency comes in. Having a burger every once in a while, I don't think that's the burger that's gonna give you the heart attack.
Mhm. Yeah.
All right, so let's talk about something a lot of people like to discount: stress.
Yeah.
What are the effects of stress on heart health and just your overall immune system or well
Yeah.
being?
Yeah. So the stress, when it comes from the physiological standpoint, there's a lot of hormones and what we call the autonomic nervous system. They all get activated in the stress, and that's part of our evolutionary background. But we generally divide the effect of stress into short-term and long-term effects, and definitely in the short term, when you get stressed, your body go into the fight or flight response. You have an increase your heart rate, you have an increase your blood pressure, and there's some conditions that having both these at the same time or having them go up quickly does not help. Whether it's irregular heartbeat, whether it's a valve problem. Um, it also, on the long run, though, it's been shown that it increases the inflammatory response in the body, and that by itself can increase the risk of atherosclerosis or the damage to the blood vessels. It can impact the sleep, which ultimately can impact the health. It can also lead to some unhealthy coping mechanisms, and it definitely affects our mental health, increases the incidence of depression on the long term. Now, a lot of people go through stressful conditions acutely, and a lot of people react to them differently, which I think is more important than the stressful condition itself, is how we react to it. Some people are type A personalities. They like to think over and over, and some people are not. So the effect of certain problem per se different on different kind of people based on how they react to it.
And the recommendations to help reduce stress.
Yeah, so as I mentioned, everyone has their, and hopefully everyone who knows that when they go through a stressful condition have their way of of coping with it, a healthy way, I should say, of coping with and dealing with it. But definitely, it's been always shown that having some form of regular physical activity, whether it's walking as we talked about, or going to the gym, or going for a run, these definitely are helpful. Using a lot of relaxation techniques, whether it's a yoga or meditation or praying, that these are can also helpful. Having the social support that someone needs, talking to a friend, talking to a colleague, talking to a family member, these are all very important to reduce the stress. And when we think that all these all these all these techniques are not helping, definitely asking for professional help is important, especially before we go into the or we revert to unhealthy coping mechanisms for stress.
Okay, doctor, it's time for our news break, but when we come back, we're going to talk about smoking on health. Okay.
Yes, sir.
Okay.
Thank you.
All right. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking to Dr. Mustafa Baldawi, and we have the pleasure of talking to another cardiologist, and this man is very knowledgeable. Take care of your heart, folks. That's all I can say. Okay. Okay. Smoking. I was a member of the United States Army a long time ago. I learned how to pick up cigarette butts, and now I'm really good at it. Okay. And the thing that bothers me the most is that it just seems like more and more people are smoking compared to less and less.
Yeah.
What do you think, doctor?
Well, let's start with the fact that smoking by itself is definitely harmful to the cardiovascular health and the lungs, and definitely involves pretty much all the systems in the body. It increases blood pressure, damage the blood vessels, accelerate the atherosclerosis process, promotes blood clotting, and I think I honestly, with the fact that it's been proven over and over again that it's a it's a significant risk factor for lung cancers, for lung diseases, and definitely uh, for heart diseases. Most commonly, obviously, is the coronary disease. I cannot I cannot tell you for sure why people do not abstain from it or stop smoking. Now there is a lot of factors that comes into that, and I'm not the specialist from the psychological standpoint or the peer pressure standpoint or growing around peers and family that smoke. These are all comes into effect. And again, we go back to the um, using smoking as one of the coping mechanisms for stress. So all these come into play, and it's sometimes it's I've seen a lot of patients where when they have a heart or lung problem, that will be their wake up call, and they just stop cold turkey. And I tell them, I mean, it's not easy for a lot of patients, but we definitely encourage everyone to stop smoking. And it's been as I said, I cannot tell you exactly why people would not stop smoking.
You know, there's lots of things to help you stop. And one of the things that just came to me in
Mhm.
the pharmacy was use nicotine patches on your knees to reduce the pain in the joints. Have you heard that?
As far as pain in the joints, I have not. But nicotine patch, it helps reduce the withdrawal from the nicotine component of the cigarettes or cigars, for example. Now,
Mm.
there there's a lot of other chemicals that can be harmful. But definitely a nicotine patch to stop smoking is not a bad idea. However, one of the side effects that we tell the patient is it can worsen or it can affect wound healing, because nicotine is a vasoconstrictor which can decrease the wound healing when it comes to patients after surgery.
So if someone's ready to quit smoking, does Aultman have a resource for smoking and tobacco cessation?
Absolutely. So for our patients who are in the hospital, there's resources who are in-house, whether hearing it from me. Always, this is very important. Always to that this recommendation is conveyed by the primary physician or the primary healthcare professional taking care of the patient. There's programs. When the patient is inside the hospital. And we have our, let me find the number here. It's 330-363-QUIT. That's 7848. And our website at altman.org/give-it-up. That's on one word, GIVEITUP. It has all the resources that anyone who is interested and who is willing to see other people who went through this journey, to find the support groups to help our patients stop smoking.
Just a comment on that, and I think that your why is really important, and I think there's something to think about too for listeners who just feel like maybe they feel like they can't give it up. There's someone out there just like you or just like your situation who's struggled with a stressful job or family or maybe something else. But, I'm guessing that like your phone number sounds like an excellent resource that you could probably talk to somebody and maybe
Absolutely.
you could find somebody to relate to that you can
Absolutely.
identify with. And that might help you get to the next step. Just have a conversation, right?
Absolutely, yeah, absolutely. It's very easy for someone who doesn't smoke to tell someone to stop smoking. But like you said, there's so many factors, and finding someone who is relatable and who you can share the journey with, that's very important. And I think it's very successful as well.
Okay. Well, all right. So we mentioned the big risk factors, related to heart health and diet and exercise and smoking. Are there any other less common risk factors you want to highlight for public awareness?
Absolutely. So we divide the cardiovascular risk factors into modifiable and non-modifiable. The non-modifiable ones are the age, being a male, and having a family history or a genetic disorder that increase the risk of atherosclerosis or aortic problems. There is the modifiable risk factors, which is what we've been talking about, including high blood pressure, the cholesterol, smoking, the diabetes. Diabetes by itself is as important as the blood glucose control, meaning if you're diabetic and you have good blood glucose control, your risk factor is less versus someone who has diabetes without good control. So both are important before and even after surgery. Stress is a big thing, which we talked about, diet and weight, and then sleep apnea also. A lot of patients tend to present with heart failure symptoms that stems uh, from sleep apnea. And again, this, and as I talked before, these are the things that get picked up by our colleagues in primary care settings where they meet the whole population, they interrogate these things and they can find them. And there's a lot of resources to help in all of those.
Jeez.
All right. So, are there any signs or symptoms that listeners should be aware of that might be a concern of potentially when to call for an appointment to be seen by a cardiovascular specialist or maybe something more severe?
Yeah, yeah. So the first thing that comes into our mind is chest pain, and usually the chest pain that make you think it's a heart versus non-cardiac chest pain is the heart-related chest pain is central. We call it mid-sternal. It's just like it's in the center, and usually we have in the textbooks the picture of either someone uh, his with his wrist on his chest, or someone imagining that an elephant is standing on his chest, which is heaviness. The radiation that comes with it to the jaw or to the left arm is also a telltale sign that tells us, yeah, this probably is cardiac. Shortness of breath is also big. Patients with valvular heart problems tend to present with either fatigue or weakness, or getting weaker with less and less activity. Palpitations is a big one. Feeling your heart rate is racing or heart rate is irregular without significant physical activity. And then the having swelling in the lower extremities or in the wrist, that's also a sign of one of the signs, I should say, for heart failure.
So, doctor, for patients who do have known heart conditions or need cardiothoracic surgery, what support is available?
So the support, as we said, let's talk about the phase after they see the cardiologist, and we decide what needed to be done for them, and let's say they get the procedure. We have a lot of programs that's either adult wellness program or cardiac rehabilitation programs, and these programs put our patients in the mentality, or I should say, in a community where they share the same goals when it comes to the cardiovascular health, when it comes to reducing the recurrence of their disease, when it comes to controlling the risk factors we talk about. And all of these cardiac rehab and adult wellness programs, they share a lot of educational material, a lot of insight on the journey of their patients, or meeting a support group, and ultimately it improves survival, and that's why all cardiac programs have these programs associated with them. Cardiac rehab, we call them for short, and ultimately it improves the quality of life after heart surgery.
So, what about cardiac rehab and adult wellness programs? How do they help patients keep their hearts strong?
Yeah. In my opinion, the biggest thing is being with a group of individuals who are tailored to keep your heart healthy, and to keep your risk factor the controlled after going through heart surgery. And definitely one of the big things that comes to these programs as well is strengthening the balance, strengthening the patient's muscles, because going through heart surgery especially is a big toll on the body, and then it takes a while for our patients to get back to their regular pace of walking or activity, or getting back into their regular life chores that they do. A lot of education helps in these programs. A lot of education is on heart health, emotional support from the staff, and from the other support groups that gets involved, and that ultimately will decrease the complications that's associated with after having heart surgery on the long run, and definitely improve survival and the quality of life for all of our patients.
Okay. Time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show.
All right, doctor, I wondered if you might touch on probably a pretty common situation that you're a part of, with a patient who was just told they're going to need to have surgery. They're probably scared. What does the process look like, especially since sometimes I'm going to assume that it might be you're going to have surgery tomorrow morning, and it might be a really quick timeline. What does like the process look like as far as preparing a patient for something that could be a really sudden experience, and then the recovery timeline look like?
Yeah. So the two main categories for our patients when they need heart surgery is either an elective or semi-elective, or an emergent. Uh, in the semi-elective situation, where the patient will have time to I would say to think about it, to get into the ask the relevant questions, and things like that. However, in the emergent or urgent situation, it can be a little bit more challenging. But here is what I tell all patients. First of all, heart surgery is a big deal. I and my colleagues and the cardiology colleagues, we do these procedures every day, so it's routine for us. But for the patient and family, It is not. It's a life-changing it's a life-changing procedure, a life-changing experience for the patient, for their loved ones, for their friends, for everyone. So that's the first thing I tell the patients. Secondly, I explain to the patients the phases of the surgery itself, how long the surgery will take, what are the preparations before surgery, what kind of studies that the patient needs, and then why are we doing the surgery in the first place? What am I going to help them with? Am I going to prolong their life? Am I going to prevent them from dying if it's an emergency situation? Uh, and the expectations after surgery. How long is the ICU stay? Some people will need to ICU 1 or 2 days. Some people are longer. The whole hospital stay a lot of times ranges within a week or so. And then the whole healing to get back to the feeling normal. You will all patients will feel tired and beat up for almost 6 weeks to 8 weeks after surgery until everything goes back to kind of some sort of normality. And I tell a lot of patients that heart surgery is big procedures, invasive, but I think of them as a as an investment for longer lifespan, to improve outcome or to prevent complications associated with heart disease. Um, and I tell all patients that the we as medical professionals, we do it as a team sport. The surgeon, just because I do a successful surgery, that doesn't mean that the patient will do well on the long run. As we said, our aim is to improve patient survival, and that doesn't mean 2 or 3 days of having good surgery and that's it. I tell all patients also that uh, a big part of their healing and of their getting better is the patient themselves and their families around them to ask the relevant questions, to encourage each other, to look ahead and improve upon what they have at the in the current situation. And again, as I mentioned, heart surgery is a big team sport. There is a surgeon, there is an assistant, there is a lot of nursing staff that help us. There is a anesthesiology staff in the operating room, and there is what we call perfusionists, which help us run the heart lung machine. And as you can imagine, there's a lot of things going on at the same time. But again, this is important, but the patient and their families afterwards is as important as all of that. And that's what I emphasize on all my patients. And again, I tell all patients that no question is simple, or no question is irrelevant, and no question is stupid, whether it's before or immediately after surgery, or 2 weeks, 3 weeks, a month after surgery. All the questions are relevant, and we give them all the resources to call us anytime to answer all their questions. So nothing will be vague to them, or nothing will be left to their guessing.
Doctor, is a heart cath always done before open heart or heart surgery of sorts?
Yeah. So a heart cath is essentially is studying the coronary arteries, and as I said, these are the small arteries that supply the muscle of the heart. Now, if someone has a heart attack, or someone having chest pain that can tell us this is a coronary artery disease, they will always get a heart cath prior, because you have to know the anatomy of where the blockages are. And sometimes the patient might need a stent. So if it's one stent, they can avoid heart surgery. Now, in other heart conditions like valvular heart disease or heart failure, usually we give the heart cath as a completion for our workup, because sometimes there is a blockages that we did not know about necessarily, because the patient had for example, an aortic valve problem, but he has one blockage. So when we fix one issue, we don't leave a blockage behind in the operating room. Very rare situations when there is an extreme emergency, which is if there is an aortic, what we call aortic dissection or rupture, we take the patient to the operating room emergently without studying their their heart. So heart cath, like we said, is 99% of the time we do them prior to heart surgery.
Okay. I had a heart cath at Aultman Hospital last year, and the staff was tremendous, and the cardiologists that did it were tremendous. All of the staff in that department should be congratulated. They are just terrific.
We have fantastic staff, and the way the design of our heart and vascular hospital, it's very tailored, and everyone is very tailored toward cardiac, vascular, and thoracic diseases. So we have a staff here who've been here for many years, and they are great from all perspectives. They have great experience. All the as I said, not only my specialty, which is mainly cardiac focused, but we have thoracic, we have vascular, and these are all surgical specialties. But again, when it comes to the cardiology colleagues, in whether it's in heart cath, in placing stents, or whether in electrophysiology, where they deal with atrial fibrillation and slow heart rate and things like that. They're all great, and we have all the resources. And again, I encourage all patients to ask the questions that you think are important to you, and don't disregard any.
Okay.
Doctor, do you want to, before we wrap up, do you want to just tell our listeners where they can get more information about Aultman Deuble Heart Center and, you know, your team? And you've given us some phone numbers for helping people quit smoking. So anything you'd like to wrap up with in summary that you think is important for our community?
Yeah, there's a lot of resources on the Aultman.org website that talks about the specialties of the need, whether it's heart related or lung related or other specialties for that matter. And definitely, as I mentioned, there's three main phases where the patient reach our specialists. There's the primary care providers, where they filter the first group of patients that goes to the cardiologist and the pulmonologist specialist, and then if there is any surgical issue, they get referred to us. Now, these are all obviously in the elective fashion, non-emergency. Obviously, if someone thinks that's an emergency situation, calling 911 and coming to the emergency department, where they can be evaluated expeditiously in case something need to be taken care of right away. So, and again, I can't emphasize it enough. I know a lot of patients get overwhelmed with how many specialists they see and how many care providers they see, but trying to focus on the most relevant questions, and trying to know the person or the team that is doing the procedure for them, and asking them the question about that. That's very important. It's very easy to get lost. I mean, but it's also part on us as physicians and healthcare providers to emphasize that for all our patients.
Okay. Guess what, doctor? We're out of time. Okay.
Great.
Hey, Dr. Mustafa Baldawi, great. Thank you.
Thank you so much, guys.
We'd love to have you back again, too.
I appreciate it. I appreciate it.
If you suspect you have any medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC. Thank you very much, Doctor.
Thank you, guys. Thank you. I appreciate your time.
Thank you very much.
Very interesting, to say the least. Okay.
Okay, I appreciate it.
Have a good day.
You as well. Thank you.